What's up, guys? Welcome back to my channel. So I am just going to take you through how I passed my exam and the best tools and tips that I use to do it, because I really want to make sure you guys pass your NBCOT exam so you guys can become awesome, amazing codas and OTRs. So I'm also going to provide you with examples on study tips, and we're going to go through like maybe 2 or 3 questions. We're going to break it down on how to study for it, how to identify it, and how to get you that passing grade. All right, so stay tuned. Okay, so let's begin. So it is absolutely crucial, okay, that you follow these 5 tips, and I don't want to say 100% guarantee. I'm going to say 99% guarantee that if you follow these tips I'm going to give you today, that I am so sure you will pass your exam. Okay? And of course you need to have general knowledge of the profession too on top of that. But these tips will help you pass. So, tip number 1. And I don't think a lot of people mention this, but they really should when they're giving this NBCOT exam strategies, is that NBCOT is a great resource to help you. They have a self-assessment. Now, I feel like everyone should go on and take this self-assessment before you even begin studying. Okay? So I'm going to take you through the self-assessment right now. Okay, guys, so what you're going to do is you're going to put in www.nbcot.org. Once you go to their website, you're going to go to, at the top there, you see where it says students. You're going to hover over that and click, and there's going to be a drop down. And in the drop down there, you want to look for aspiring student tools. And if you scroll down to aspiring student tools, at the bottom, you'll see self-assessments, and you just simply click on that. Okay, and then you're going to see this pop up. Now, the self-assessment, it says here, it's an excellent resource to help you identify a self-perceived indication of your knowledge, skills, and experience in relation to the validated domains and tasks of OT practice. Now, the cool thing about this, here, let's go and click on one. The cool thing about this is this kind of gives you your entry level of where you're at. So when you take this assessment, it just lets you know that, okay, this is where I'm starting out. Maybe this is where I lack. Maybe this is where I'm strong in. And it's just a good tool, guys. Definitely utilize. All right. Tip number 2. Do not memorize. Or I should say it like this. Do not focus on memorizing only. I know when I was sitting for my exam and I did a little study group with a friend of mine, she had like pages of notes where she was just like with definitions, and she was just like memorizing. And I was like, how are you going to retain all that information by memorizing? And I was like, well, we're friends and all, but I really can't study with you because I can't study that way, because there's no way I will remember it. So my tip to you is don't memorize. Become a critical thinker. Okay? This is going to make a little bit more sense when we break down the questions on how to do this, but I can't stress this enough. You cannot memorize every single thing. And maybe there's some people out there that's really good at memorizing, and they can memorize the whole book, whole study guide and know everything. But for most people, that's quite difficult. And I think when you memorize, it influences you when you're sitting down, because now you're trying to recall everything, and you might get a little confused. You might start sweating, and, it might just, the thought and everything that you memorize might just go away, because you're starting to panic now because you're feeling the pressure. And it is pressure because it's a timed exam. So definitely become a critical thinker, learn how to relate the information on a basis as if this was me or if I was sitting with my client, how our outcome should be or result in. Okay, don't worry, it's going to make more sense at the end. All right. Okay, guys. Tip number 3. Tip number 3 is you want to have a pretty good basis, or I should say generalized understanding of the 4 elements throughout the lifespan when you're dealing with patients, regardless of the setting. And usually throughout the program, it is broken down for you. So these 4 levels are your physical disabilities, your older adults, which is primarily skilled nursing facility, mental health, and pediatrics. Okay, so those 4 elements, you really want to have a good understanding of them. Now, really cool tip is if you're interested in working with older adults, then make sure, because usually schools will allow you to do, 2, I believe it's 2 field works. It's been a while. I think one is a shadow and then one is your, no, I'm pretty sure it's 2. Yeah. What am I saying? Yes, 2 field works you get to go on. So definitely go on the one of choice that you are looking forward to. So if you want to work with older adults, definitely go and take a field work with older adults. But if there's one that you're like, there's no way I'm going to do it, absolutely not. I don't care to work with this population. That's the other field work you should go and be in. So for me, when I was starting out, I already knew I wanted to work with older adults. I'm like, yeah, I want to work with older adults. That's just my niche. I already know it. And the complete opposite of that is pediatrics. And that was just something I'm like, I have no desire to work with kids. Kids are great, but I just didn't want to really work with them. So I made a decision to have my first fieldwork actually at a pediatric clinic, which was a sensory integration clinic / school based. So I got both worlds, where I was in the clinic for a couple of days out of the week, and then I went into the school, and I ended up actually liking it. I liked it. I still didn't want to do it as my profession, but I did like it, and it gave me a really good understanding of pediatrics, because that was always a little bit of a challenge for me in school. But it was definitely worth it, because once I sat down for my exam, things came back and it made sense. Okay? All right. Tip number 4. So I'm going to have you guys take a look at this breakdown here. So NBCOT, for the quotas, it is on a scale of 300 to 600 scale. You need a 450 to pass. Now, any incorrect or questions that are left unanswered are all scored the same. So it's so important that you don't leave anything unanswered. Even if you just don't know the answer, just take your best guess and plug it in. Now keep in mind, January 2nd, 2019, there was slight changes in the exam. So you definitely want to go to NBCOT and check their website for the details. But I'm just going to give you a quick general breakdown on the items and the focus of the exam. So for quotas, all right, so there's 200 total items, and it's covered in 3 general areas. Now, these 3 general areas are broken down into what they call 3 domains and percentages. So the first one is about 28%, and this is collaborating and gathering information. Which I would say for that one, have a really good understanding of client-centered intervention. Okay. Now, 55% of that, which is a huge chunk, is intervention-based. So definitely brush up on evidence-based intervention. Okay. And then the last one, which is 17%, is professional standards and responsibilities. So you really want to understand the ethics, your role as a coda for that one. Now for the OTR exam, Theirs is a little different. They have 4 domains, and their domains are broken up into 25% is evaluation and assessment. So guys, make sure you really have a good understanding on how to create an eval and how to assess your patient when you're interviewing them for the first time. 23% is analysis and interpretation. So this is where theory comes in. So you definitely want to have a good understanding of theory and how to apply it. Now the biggest chunk of the out of the 4 domains is 37% is all about intervention. All right. So pretty big deal there for you guys. And then the last one is 15%, which is competencies and practice management. I would definitely get a good understanding on how you are supposed to work with a CODA, because I went into a facility before where I was helping out, and I had a supervising OTR. She was fairly new, and she really didn't realize that she's supposed to be supervising a CODA, which is kind of crazy for me to understand, because you're supposed to know your role before you graduate, but she didn't realize that she's supposed to be supervising a CODA, so she wasn't sure on the relationship. So I kind of had to guide her a little bit, respectfully, show her the ropes and whatnot. So that is tip number 4. Okay, so now we're going to go into tip number 5, which is my favorite. It's time to break it down. All right, so here we go. Okay, so I have 3 questions for you guys. I was only going to do 2, but I said, you know what? Let me give you guys a third one so we can really dig deep and make sure you guys pass. All right. So here we go. The first question, I'm going to read it out to you guys, and then I'm going to give you some time to think about the answer and actually pick your answer. And then I'm going to tell you what's the correct answer and why, and how to break down that question. Okay. So the first question says, the CODA is treating a patient with ideational apraxia. During the initial treatment session with the CODA, the patient displays one of the following behaviors. A, the patient is unable to perform fine motor tasks. B, the patient is unable to perform gross motor tasks. C, the patient cannot identify objects with eyes closed. And D, the patient uses a sponge to brush teeth. All right, so I'm going to give you a little time there to think about which is the right answer and why. I'll give you a little background music. Do 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 do. All right, I hope you guys had picked your answer by now. So the answer is D. D. The patient uses a sponge to brush teeth. Why and how did I come about this conclusion? Now, some of you may look at this question and might not have any idea what the heck ideational apraxia means. All right. Now, this is where having evidence-based understanding comes in. Okay. So, and there's a key word in here that is going to kind of help you figure out what is really the right answer. And that key word is behaviors. All right. It says the patient displays one of the following behaviors. All right. And it's also saying during the initial treatment session. Okay. So so you already know it's something they're actually doing, something they're performing. Okay. When you see that word behavior, ideational apraxia, for those that do know, let's say if you only know what apraxia means, apraxia has to do with the inability to, perform a specific movement. All right. So ideational apraxia means the inability to create, execute, or plan a specific movement. in simpler terms, it just simply means that a person uses an object incorrectly. So, like I said, using the word behaviors can kind of help you break this down. So if we go back to letter A, it says a patient is unable to perform fine motor task. Using unable, that word there is just saying they're unable to do this particular task, but it's not saying what they're doing. It just simply say fine motor task. So it's a little, that one is a little broad. And then it says patient cannot identify object with eyes closed. Now, that one right there, that should be the first one that you say that this is not it, by understanding what sterganosis is, okay? And then the patient uses a sponge to brush teeth. That is actually showing you something is being performed. So that could kind of help you break that down, because there's something being done. There's something this person is seeing being done. Okay. The letters A and B are really broad. It just says perform gross motor tasks, but it's not really telling you what is happening, what the behavior is. So that could kind of help you with that if you didn't know what ideational apraxia means. Okay. Now, one thing that can get confusing is that word apraxia for ataxia, which is ATAXIA, and that means the lack of motor control. So pay attention to your wording, because sometimes with an NBCOT exam, it gets tricky and people get caught with stuff like that. So definitely take your time and make sure you read. First you read it, and then you think about what is being said. Okay. All right. Let's go into question number 2. Here we go. A patient came in with a diagnosis of Skier's thumb. Which splint would be most appropriate for this patient? All right, so this time I'm going to let you guys read A, B, C, or D, and you let me know what you would pick. So I'm going to give you some time to figure that out. All right. Now, if we're talking about wrist cock up, just think about the terminology if you didn't know what the diagnosis of Skier's thumb is. Because when I first read this question, I was just like, I don't really know what Skier's thumb is. And that's okay. You're not going to know everything. But I just thought about, okay, skiers, how do skiers ski? Usually their body is upright, right? So I'm thinking, okay, if I'm thinking about my thumb, right? My thumb is not down. My thumb is not straight. My thumb is most like going to have to be upright. Okay. And then the first one was wrist cock up. So if I'm focusing on that thumb and that hand, a wrist cock up is going to have me up, right? Instead of the word, think the wrist, cock up. So I'm like, that's not going to work. Then MP block for ring and pinky fingers. Now, even if you couldn't remember what MP is, which you should know, but if you didn't know what that is, you can simply look at ring/pinky and know that, okay, my pinky and my ring finger is here. We're not talking about those fingers. We're talking about the thumb. So you know that is canceled. Okay. Now, letter C, hand-based thumb speca. All right. Now we're talking about the hand, right? Hand-based, and we're talking about the thumb. Okay. So that mentions the thumb there. So that kind of like, I'm looking at that like, okay, that could be a possibility. And then D, it says forearm-based thumb speca. Now it's talking about the forearm. So it's including your forearm as well as your thumb. Now, this is where your critical thinking skills come in. So you're looking at this and you're saying, okay, skiers usually are upright, their body is straight. So this means that the splint needs to reflect my thumb being straight to protect it. Okay, so I will go with letter C. Letter C, because identifying closer to what the question is asking you. It's a hand-based thumb specker, even if you couldn't remember what that is. Now, if you know what a skier's thumb is, or you have a general idea of the splint, then this question should come easy to you because you understand what different splints look like. Okay, so if you didn't figure that out yet, the correct answer is C. Okay. All right, and just to give you a quick understanding of what skier's thumb is, it is a rupture of the ulnar collateral ligament of the MCP joint of the thumb, which is down here. Okay, and I'll post a little picture there of the splint so you guys all know what it looks like. All right. Question number 3. Okay, here we go. Which of the following statement is true regarding parallel play? Now, this is a pediatric question. All right. A, it involves an organized group with a goal. B, children involved participate in independent activities. C, one child is watching others play. Or D, children play alongside each other, but not with one another. So I'm going to give you some time to think about that, and you tell me what's the correct answer on that. All right. So the correct answer is D. D. Children play alongside each other, but not with one another. All right, so how would you figure this out if you didn't know what parallel play really meant? So keywords here. So when you're looking at these questions, you always try to identify keywords, okay? So the keyword is true. Okay, so what is true? So you're looking for something that's factual, and the other keyword is parallel. Now, even if you didn't realize what parallel play together meant, you got to understand that the word parallel means alongside, right? And that kind of shouts to you in letter D because that word pops up. Parallel is side by side. So once you see that word there, alongside, that kind of gives you a little indication that is probably the right answer, which it is. Now, if you know what parallel play means, then that's an easy question right there for you to answer, which simply means that it's children that are playing together. Sometimes people be like, oh, they're so cute, they're playing together, but really they're not. They're playing alongside each other. All right, so I hope that helped. If you guys have any questions, be sure to comment, like, and share. All right.